the reality is that cancer survivors are more likely to die of heart disease sometimes than they are of breast cancer.
We love to talk about statistics, like the one that tells us if you're diagnosed before stage 3, then you've got a 99% chance of still being alive in 5 years. All those sound like pretty great odds when you're diagnosed. Just the fact that you're entering a completely new reality where this word survivor is now a part of your everyday vocabulary and a label has to be scary. Dr. Dawn Hershman leads the breast cancer program at Columbia University. She is a tenured professor of medicine and epidemiology, and she is a nationally recognized expert in breast cancer treatment, in prevention, survivorship, and a whole lot more. We're super proud to call her a Komen Scholar. When you're diagnosed with breast cancer, I think the first thought in your mind has to be, am I going to die? When you are doing your research and you're in the clinic or you're talking to patients, how do you address that initial gut reaction?
That's an excellent question. I think that, it's a serious thing that nobody ever thinks is going to happen to them. Nobody ever thinks they're going to be on the other side of that desk hearing those words, you have cancer, but there's so much room for optimism when you explain the whole scenario. Yes, it's scary. Yes, it's life-threatening, but we have a lot of knowledge now that we didn't have in the past. We know who needs treatment. We're better at figuring out what kinds of treatments people need on a personal level. And, while it's hard to get through the treatment, we have come a long way in terms of supporting patients, reducing short-term side effects, and reducing long-term side effects. We still have a long way to go, but I think we can feel encouraged that we're making a lot of progress.
It must be super encouraging to hear, from your doctor, hey, you have this, but we've got lots of options. So when you fast forward, and as a patient, you've gotten through what you feel like must be the hard part, right? Maybe you've gone through surgery and you've had radiation, you've had chemotherapy, and now you wait. And it's this phase, I think, that we call survivorship, right?
Yeah, the NCI defines survivorship from the minute you're diagnosed. But I think, commonly people think of survivorship as the period starting when their initial intense treatment is over. And interestingly, we know from a lot of research that, when you're diagnosed and going through treatment, you sort of get on this like auto mode. Okay, I have to get to the next phase. I've got to get to the next treatment. And then when it all stops and you're not coming into the office as often, that's when a lot of the emotional effects of the treatment can sort of overwhelm people. They think, okay, now I'm done. I'm going to feel better now. But often that's not the case. Often that's when they start to realize, oh my goodness, what did I just go through? What does this all mean? What if the cancer comes back? What do I do then? Then you have knowledge and fear, but sometimes you don't have a place to put it. And also at that point, the other effects of the treatment come in. Fatigue. You think it's going to get better, but it persists. Issues related to finances. All of a sudden, all of the bills start to come in from all of the treatments and doctor's appointments, missed work. A lot of other considerations come into play. How am I going to afford this? How am I going to work? Do I have the energy to work? And how am I going to deal with all of the persistent side effects that still remain even though I'm done with my treatment?
So there are really two aspects to this survivorship piece, and the first being physical and the second emotional.
Oh, yes, exactly.
There's
There's a big emotional component because, for women at least diagnosed with early stage disease, there's always the concern, have I done enough? What if it comes back? But we're also dealing with a different type of survivorship population now, because sometimes women now diagnosed with advanced cancer, with metastatic cancer, sometimes live 10 years with their disease or even more. We've made such progress with treatment. We have a surviving population of patients with metastatic disease who need chronic treatment, chronic scans, but still, need to, want to live their life, just like anybody else would. So that's a whole other area that we're dealing with.
Very different from a woman who was diagnosed. She's gone through treatment, and at least to this point, it has not reoccurred.
Yeah, oh, yes, exactly. For 2/3 of women that are diagnosed with breast cancer, their cancer's hormone sensitive. So even though their immediate chemotherapy or radiation therapy may be over, they're still taking medication every day, which is a reminder that they have cancer. And it's a really hard reminder because their cancer is essentially gone. They have no physical evidence of any cancer, being in their body, but they have to take a medication that often has a whole slew of side effects. So you have the emotional and tied into the physical, and it can be really challenging for people. Often patients stop their medications even though their medications could keep their cancer away.
So let's first talk about, if we can, those physical side effects that you're talking about, the lymphedema, what are some of the other side effects from somebody who doesn't have breast cancer? We don't know what are those? What are the challenges physically?
Right. So, very commonly, women that have had chemotherapy often receive treatments that can cause numbness and tingling in their fingertips. That can be during their treatment, but we've learned recently that 2/3 of women, if not more, have some symptoms that persist after that. And so it's a constant reminder. We don't have good ways of making that go away. There is issues with regard to joint pains and stiffness. Often the hormonal therapies that we give can cause stiffness in joints, especially when you get up in the morning. That can be very challenging for women. We've learned that various different types of treatment can actually help that. Exercise, diet, different kinds of supplements like omega-3 fatty acids, acupuncture. So there are things that can be done. I think one of the most troubling things women face is a sense that their body's not the same anymore. A lot of women gain weight during treatment. They become less physically fit. Their hormones have changed, so their metabolism changes. They've been through surgery, which can alter their perception of themselves. So that can take a lot to work through just to feel better about yourself physically.
So really, these physical symptoms are tightly intertwined with the emotional, really, trauma that comes following this diagnosis and treatment.
Yeah, absolutely. And I think people, when people are, a lot of times when women are first diagnosed, they have this huge support system. But as time goes on, friends that maybe have never been through it and don't understand it, expect them to instantly be better. Their hair is growing back. They're done with their chemotherapy. So the expectation is that they should feel happy. But there's a disconnect because many women don't feel so happy when everything is done because they're still suffering. And so part of it is feeling isolated.
That has to be very challenging during a time when you really need more support than ever. But you're right, they look okay, so they must be okay.
Right. I think people often their expectations are disconnected to their reality, and so they're disappointed. Luckily, there are a lot of venues for people now. A lot more people are open, and so there is more support. But not everybody seeks that support.
So if a breast cancer survivor is listening, or a fighter is listening, and they're at that place where you have, lost some friends perhaps, or they've just kind of drifted, right? Because that emergent time seems to be over. Is there advice that you would give?
Yeah, I think that one, to take it slow, right? Recovery's not fast. It's slow, and so your expectations have to be realistic. I think support groups and organizations such as Komen can be incredibly helpful because people can hear that they're not alone, that other people have gone through this and faced some similar challenges. I think people don't realize what a huge financial burden a diagnosis like this can be, even for women that have insurance in this environment. And there are organizations out there that can help with finances. And I think people are somewhat embarrassed when they're suffering financially to figure out how to bring that up. And we've done research where we've seen that women become less adherent to their treatment, to their oral therapies because of the cost of prescription drugs, to their follow-up appointments because of co-payments. And, a lot of pharmaceutical companies have programs that can help people that they may not be aware of. And I think that, a lot more work needs to be done to make sure that people have access to the treatments that they need that can prolong their lives.
Would you say that some of those financial burdens, not only are we talking about cost of the procedures or the drugs, the co-pays, that you're talking about, but then just managing your own personal finances with respect to, we hear a lot of patients talk about what they call chemo brain, where they get confused, lose track of things. I can't imagine trying to manage finances that's as complicated as insurance can be when you're maybe a little cloudy.
Oh, absolutely. Yeah. It's hard to manage it at your peak. And, it puts a stress not only on the patient, but the entire family. And so, very little work has gone on to delve into what that can do to the family structure and understanding the implications of that financial toxicity. But people are starting to become more aware. As we become more aware, then, we can develop solutions.
So one of the other aspects of survivorship really is, so first we'd love to be able to help patients be more financially sound, find that support that they need financially. We hear a lot about healthy lifestyles, so I think that financial piece certainly plays into that. What other, kind of lifestyle choices, if you're a survivor, should you be making?
Lifestyle is hugely important to breast cancer survivors because not only is it very much related to how people feel on a day-to-day basis, it could actually have a role in terms of reducing the risk of recurrence. So, issues related to weight gain and body mass index, diet, not only do they make people feel better in the immediate, we know that there's a lot of susceptibility to gaining weight because of all of our treatments. And trying to figure out ways to control that can be challenging. There are a lot of programs out there that people may not know about that are free Often local YMCAs have programs. I think a lot of the gyms have programs specifically for, cancer survivors. Being part of support groups where people walk together or exercise together. Programs like Weight Watchers, where there's a specific focused program for eating, can make a difference. People have to do what they like, whether it's dancing or walking or whatever else that is compatible with their work and their environment. But all of those things make a big difference in terms of both how people feel, in terms of the side effects that they have, as well as their potential longevity.
So if I'm a patient and I'm doing all the right things, so I've gotten through treatment, I'm taking my medicine, I've got a great support system around me, I'm making healthy lifestyle choices, and there's still that remaining fear that you mentioned earlier. I'm taking a pill every day, and it's that reminder that I still have this disease, or maybe I don't, or maybe I do.
Right.
Can you tell us a little bit about who gets it again? Do we know who has that local recurrence or is diagnosed with metastatic disease? Are we closer to understanding who gets a second round of this and who gets a pass?
Well, I think, one of the things that's so challenging is that, we treat people based on statistics a lot of times. We know that women with breast cancer, their cancer is gone. We're giving them treatment to kill disease we can't see, and then we're keeping our fingers crossed that it doesn't come back. And, there are some very basic factors that influence the likelihood that the cancer will recur, whether it's, the more advanced stage, the more likely it is the cancer will come back. The biology of the cancer, we know that some cancers are more aggressive, such as the triple-negative breast cancers, compared to cancers that are hormone receptor positive. We know that patients that were treated with cancer therapies before their surgery and still have residual disease at the time of their surgery have a higher risk of recurrence. And so, there are some physical factors, but then there's a lot of mystery. We do know that there are women that do everything right, that, have stage 1 cancers, that get all the treatment they're supposed to get, that exercise and diet and, take their medications, religiously every day, and their cancer still comes back. And I think the most important thing is to know that, you have some control, but there's a lot of things that can happen that are out of your control. And it's not that you did anything wrong if your cancer comes back. And a lot of people sort of place blame on themselves, like if only I had done this or that, maybe my cancer wouldn't have come back. But there's still a lot we don't know, and we're learning a lot more about, what might trigger the body or the immune system to have the cancer cells suppressed and other things that might make them grow again. And we're also developing better genomic tools to help try to figure out who might be at higher risk so we can maybe treat those patients more intensively. But unfortunately, we don't have any magic test that will tell somebody that they're the ones whose cancer is going to come back at some future date.
So no crystal ball just yet on that. When you are unfortunate enough to have that diagnosis, when we talk about survivorship, that's kind of a loaded word for some people, I think, from the metastatic patients who don't necessarily feel like that's indicative of what their future looks like. How is survivorship, in air quotes, different for them?
Yeah, I think you bring up a big really important point, and it's an issue of linguistics, I think, and our perception in the past that because so many of the women that are diagnosed with breast cancer are diagnosed at an early stage, that we've equated survivorship to just the individuals with early stage disease whose cancer hasn't come back. But we need a new word, really, that encompasses all of it so that everybody feels included in that. I have many patients that have been alive far longer than any statistic would have told them looking on the internet or in a textbook. I have patients with metastatic cancer that are alive over 15 years at this point, still with a perfect performance status, working every day, going to all the events that they would go to, and there really are survivors. They're not cured of their cancer, but for all we know, they may be, because around every next corner, every new approved drug, that may make them live that much longer. We know that the reality is that cancer survivors are more likely to die of heart disease sometimes than they are of dying of breast cancer. And so when we think about, living, we have to not just focus on the fact that we have breast cancer or we had breast cancer or whatever the terminology is, because people are complicated. They have all different kinds of things. And I think that sometimes people forget that they have to take care of all those other things too, no matter where they are in their stage. They still have to, even if they have a breast cancer diagnosis, they have to take care of their diabetes. They have to take care of their high blood pressure. They have to take care of their cholesterol, because those things can impact their life expectancy as well. For women with metastatic disease, it's a different kind of challenge living with metastatic disease, because there's certainly much more uncertainty. But I think that we really have to include those women in our discussions, because they really are surviving and living with their disease.
Absolutely. So survivorship truly is about multiple things. It's about physical surviving. It's about surviving financially and surviving emotionally as well.
Absolutely, yeah.
It's the whole lifestyle. So what would you say? Is there a piece of advice that you could give to a breast cancer patient who's just been diagnosed, or somebody who's in survivorship that walks into their doctor's office? What do they need to be asking? How do they need to be feeling? And is there something that you would say to them?
Yeah, I mean, it's. I think people have to understand that it's a process, and that information's constantly changing, and that they need to be aware of all the new things that are out there, but they can't let this overtake their lives. So they have to make sure that they continue to do all the things that they enjoy, and not make this their sole experience from then on out. I think that people need to realize that it takes a lot of time to get back to the way they were. And that, sometimes people change as a result of this experience, and that's okay. But, they need to focus on, the emotional health as well as their physical health, and realize that there are services out there, there are supportive treatments out there if they're not really dealing with their symptoms or side effects as well as they would like.
Survivorship seems to be as much about finding your way emotionally as it is about beating breast cancer. Whether you're newly diagnosed or in year 5 of a metastatic journey, it's the quality of life, truly surviving, that seems to matter most. A big thank you today to iHeartMedia for making each and every single podcast happen. Thanks, Mike, for another great show, and for putting all of these pieces together with your magic board. Thanks to Jacqueline, my intern, who helps me with that research piece, and the entire Komen Austin team. Susan G. Komen Austin is an affiliate of the Susan G. Komen Breast Cancer Foundation. And if you need resources, information, or just have a comment about this or any of our episodes, reach out at podcast@komanaustin.org. I'm Suzanne Stone. We'll talk to you next time. And always, be more than pink.